Hello, my name is Carole Lunny and I'm with St. Michael's Hospital in Toronto and the University of British Columbia. I am here presenting our study entitled Over Half of Clinical Practice Guidelines Use Non-Systematic Methods, which is published in PLOS 1. Please tweet us at Carole_Lunny. I wish to acknowledge the traditional ancestral and unceded territory on which the research team operates. We have no conflicts of interest to declare. Our primary objective was to assess whether systematic methods were used when synthesizing the evidence for clinical practice guideline recommendations. So many international standards exist to promote a systematic process to inform guideline recommendations, including the IOM, GIN, GRADE, and the World Health Organization. Despite these standards, recent surveys of 1,100 guidelines indicate that the quality is moderate to low. So several different types of reviews can inform guideline recommendations, including literature reviews, which use a non-systematic process to gather and synthesize all types of evidence, systematic reviews, which use a systematic process to gather, assess, and synthesize primary study evidence, and overviews of reviews, which synthesize the results of systematic reviews, guidelines, or health technology assessments, which can use either a systematic or non-systematic process. So for our methods, we used a randomized process to select 50 guidelines from the TRIP and Epistemonicus databases. We did duplicate independent screening and data extraction. So we ended up including 50 randomly selected guidelines. The majority of these were produced in North America, followed by Europe. Half of them had both a pharmacological and non-pharmacological scope. 1/4 were produced by industry and the majority by a medical society. 96% of the clinical practice guidelines declared conflicts of interest, even though one or more authors were financed by industry in some capacity. So in Table 2, we see that of the 29 guidelines that included systematic reviews, only 10% assessed the quality of the reviews. And finally, the quality of the primary studies was reported in 60% of clinical practice guidelines. For our results show that of the 50 guidelines, only 17 or 34% used a systematic approach as seen here in green, and 66% in blue used a non-systematic approach. The 17 systematic guidelines we found clearly reported their objectives and eligibility criteria, conducted comprehensive search strategies, and assessed the quality of the included studies. Here is an example of a best practice guideline by the Thoracic Society of Australia and New Zealand, which contained here, Chapter 2, a full methods section. So in conclusion, when evaluating a random sample of recent guidelines, we found that 66% did not use a systematic process to gather, appraise, and synthesize the evidence to inform recommendations. It's important to appreciate this major limitation of guidelines. Our findings are confirmed by previous research and suggest that serious methodological problems are widespread. Guidelines should report key methods and evidence used to underpin recommendations consistently and transparently. And assessing the process used to synthesize the evidence in guidelines enables users to determine the trustworthiness of the recommendations. I thank you for your attention and I welcome questions.